Good afternoon, everybody. Thank you for joining me. My name is Laura Wilkerson, and I'm a nurse practitioner with Advanced Medical House Calls and Dementia Care Academy. So last week we talked about sundowning syndrome, and I got lots of messages from you guys saying how useful it was to use the drive technique. If you didn't catch that video, I suggest that you go back and check it out. So drive, what does that stand for? Distract, reassure, interact, validate, and always show empathy. But this week, end of a person's life. Good morning, Ken, or good afternoon, I guess, actually. Good afternoon. I was talking to you this morning. Good afternoon. Thanks for joining. So terminal agitation, what is that? So as a person is coming to the end of their life and they may have any illness, they may have cancer, congestive heart failure, any of those chronic conditions that can lead toward death and decline, any of those can cause terminal agitation. So as a person comes toward the end of their life and they are maybe they're on hospice, maybe they're not on hospice, but as that person comes toward the end of their life, there can be some symptoms sort of like that mimic those of a urinary tract infection. And I know people will always ask me, how do I tell the difference between a urinary tract infection and terminal agitation, restlessness in my loved one? Well, the only way to really tell that is to get a urine culture and sensitivity to see if your person has an infection. But if your person is on hospice, your nurse is going to be educated and she's going to know and she will be able to talk to you about what that looks like. So between 25 and 85% of patients who are dying actually experience these symptoms that are associated with this restlessness, with this agitation before passing. So what does that look like? Well, your person may be suddenly full of vigor. They may be able to do those things that they couldn't before. So if you have a loved one who is bedbound, they may be sitting up in bed. They may be trying to get up out of bed. They may be talking to you in complete sentences where they weren't before. So you can see that side of the fence where your person actually appears to be having like a rally. They may actually get better before they decline. Sometimes you may see that they're extremely agitated, that they're combative, that they are argumentative, and certainly their cognition is very impaired. Their sense of reality is not so much there. They may become suspicious. They may become delusional. They may become even delirious. You may notice that they're twitching, like certain parts of their body may be twitching, their legs and their feet, their hands, even sometimes their head can have a twitch. They may be, like I said, irritable, or they may have impaired consciousness. Oftentimes they'll have those hallucinations. They're hearing things, they're seeing things. People are under the bed, they're hearing voices. All of these things, again, sort of like sundowning, are very real to them. Please don't try to correct them because it is real. Like I said, just make sure to be really empathetic and convey that they are safe and that they're okay. So, what are some of the possible causes of terminal agitation? Well, when your person is at that end of life stage, well, you could have opioid toxicity, meaning that they've got too much medication in their system. Now, this isn't necessarily always so true with a patient who's having their medications controlled by hospice. Hey, Jessica, thanks for joining. Nice to see you today. But if your person is alone and they have pain medication that they have in their home and they're responsible for taking that medication themselves, they could certainly take one too many or many too many, and they could experience what we called opioid toxicity. And so that could cause them to be agitated or become delirious. Uncontrolled pain at the end of life, That is a huge cause of agitation. How do you know that your person is in pain? Well, if you're touching them and they're wincing and pulling away from you because they're nonverbal, that's one clue that they may be hurting. If they are incontinent and you're going to roll them to make sure that they're clean and that they're dry and they're wincing or moaning and groaning, that's another cause. But always making sure to know where your person's baseline is. If they're having pain, did they ever have pain? Maybe are they in pain now? Is important because later, toward those end stages, communicating their pain is going to become much more difficult. And so we're going to want to pay attention to that. Sometimes drug interactions, those drugs that we take or we give toward the end of a person's life, sometimes those medications can cause that delirium and that restlessness and that agitation. So always making sure to know ahead of time what your loved one was taking and making sure that you keep that list up to date. If your person is on hospice, always asking, hey, what is it that we're giving now for my loved one? And if they live in an assisted living facility, making sure that you get that med list and that you keep current on what they're taking. Another cause of agitation could be fever or what we say in the medical term, sepsis. So do they have an infection somewhere that's affecting them? Might they have a urinary tract infection, which we always go to first. It's the first thing I see in all of the groups when somebody mentions that their person is a little bit off. The first thing everybody starts talking about is, well, maybe they have a urinary tract infection, because that's really common in our elderly. And the fact that they might not have those sensory, the sensory for that anymore. They might not feel the pain in their lower abdomen, or if they're incontinent, they might not have pain with urinating like you would if you were younger, because they've constantly got that little bit of dribble, or maybe they just don't notice. Or if they have a catheter, they're not going to notice those things. So checking their temperature, you can just do that with the back of your hand. Or if you're not somebody who has to social distance, putting your lips on the forehead of your loved one can tell you if they feel warm to touch. And if you suspect that they have an infection, making sure that you either get blood work. If your person is not, or you don't think that they're at end of life, getting some blood work, checking for that urinary tract infection. For those people who have specifically cancer diagnosis and they are at their later stages, end stage of life, a common cause for this, maybe some terminal agitation, might be hypercalcemia. So when your calcium levels become elevated, it can become life-threatening. So really watching in those that have a cancer diagnosis, watching for that calcium levels. If they go too high, that could certainly be a cause of that terminal agitation. Again, this is another rare one, but for those people who have brain tumors or metastasis to the brain with a cancer from someplace else, that cancer can cause increased intracranial pressure, and that pressure on the brain can cause your loved one to become agitated and irritated. So for those people who have that cancer diagnosis, watching to see if their blood pressure is rising or lowering, making sure that you're watching that. So what can be done about terminal agitation? So you've discovered that your person is terminally restless. You've ruled out all of those things. Certainly, I get asked this question a lot. When is it appropriate to bring hospice in? In my opinion, if you're asking that question, well, then it's never too early. If you suspect that your person is near end of life, or you're thinking that they might be getting close, I don't think that it's ever too early to have hospice come in and evaluate. If your loved one or your friend or your person is not appropriate for hospice, they're not going to admit them to hospice services. So I don't think it's ever too early to have them come in and just take a peek. Now, if your person is experiencing this kind of terminal agitation, hospice certainly has medications that they can discuss and go over with you and start in your loved one. And if your person isn't on hospice and they're experiencing terminal restlessness, like I said, you're going to want to reach out to them. But reaching out to your doctor in the interim, talking to them about what's happening, what's going on, and if your doctor feels it's appropriate, making that referral. If not, you can always reach out yourself. Your doctor may, in the interim, prescribe some medications. Typically, those medications are medications that will decrease the anxiety levels in your person. They may be the benzodiazepine group. I know I see that word. You guys are using that in the groups that I'm peeking in and out of often. Yes, you can give those. You can give pain medications to control, antipyretics, your Tylenols, your Motrins, trying to bring those fevers down. So those are some of the causes. Again, you can, first and foremost, I think, look and see if your person is having pain, because pain is something that you can easily treat at home with Tylenol, if it's not a super acute pain. And then if it's a pain that goes above and beyond that, reaching out to your doctor or your hospice agency to see if they can prescribe your loved one something that will get that pain under control. All of the other causes, again, will need to be discussed with your doctor, because everybody who experiences terminal restlessness or terminal agitation doesn't go through it the same. So although we've described this person who's extremely agitated or might have lucidity, everybody is different. So we're all going to experience that differently than the next person. If you've ever experienced this, or you suspect that your person has, share what that looks like for you below. Because like I said, the more we can share, the more we're going to, teach each other. And that's the best way to learn. And finally, turn around the negative connotation that surrounds caregiving and that negative connotation that surrounds dementia and its diagnosis. We need to focus on all the positives and the resources that we have, and we all have each other because we're in this together. So have a happy weekend. Thanks for joining me today. If you did, share this information to those that you know who may be experiencing it, and we'll see you next week.